Hello, this is Dr. Dane Treat, and I am coming to you from the American Medical Society and Sports Medicine Annual Conference in Atlanta, Georgia. And this morning I had the opportunity to sit in on a presentation by Dr. Robert Johnson, and I wanted to ask him a couple of questions regarding that I think you guys might find helpful. Now, first of all, Dr. Johnson is on faculty at the University of Minnesota in the Sports Medicine and Family Medicine Department. He's a team physician for the University of Minnesota. He is a founding member and past president of the AMSSM, but more importantly, possibly for you guys, he has completed 72 marathons. That's very impressive.
Thank you.
So, and also he stated this morning that probably about 50% of his patient population are runners. Is that correct?
It is a particular practice, about half of them are runners, that's correct.
Okay, and a lot of long distance runners?
Mostly are competing anywhere from 5K to marathon and ultra.
Okay. Are there any exercises that runners can perform that you feel like are real helpful for core strength and may, lessen their risk of some injuries down the line?
Well, I think there are 5 muscle groups where I pay attention. There are probably more, but to try to keep it simple and doable, I recommend working on the transverse abdominis muscle, which is the deepest of the abdominal muscle layers, not usually affected by our classic sit-up and crunch exercises.
Okay.
Secondly, I do work on both the key butt muscles, the gluteus medius, by doing side-lying leg lifts or a side plank. I'd work on the gluteus maximus by doing specific what I call butt bridges, and then I would focus on groin muscle activity, and the final one doing partial squats to emphasize the strength of the quadriceps muscle, which will also incorporate the muscles of the butt.
Okay. And we'll show some little video clips of those different exercises. But Dr. Johnson, thank you for taking the time.
You're welcome.
All right. Have a great conference.
Thanks.
Okay. Hi, this is Dr. Treat, and I'm going to demonstrate some examples of exercises that you can use to target each of the muscle groups that Dr. Johnson was talking about in this video. The first exercise for the transverse abdominis is just the tummy tuck. To do this, just pretend like you're trying to squeeze into a pair of jeans that's just a little bit too small. So you want to suck in your gut real good. When you do this, you're going to be pulling your belly button both back towards the spine and up towards the rib cage. Now, it's important as you do this to continue breathing. It's not something that you want to hold your breath while you're doing. Now, you can do this and you can hold it for several seconds, relax, repeat it, hold it for several seconds. You can also do this exercise as quick little pulses. Just contract, relax, contract, relax, contract, relax. Now the next exercise for transverse abdominis is called a plank. And this is the general plank position right here. There's both a high plank and a low plank. Basically, this would be the high, this would be the low plank. What you want to concentrate on is keeping your back and butt and legs in a fairly straight line. You don't want to bow your back like this for sure. And you don't want to arch your back. This is a different type of an exercise. We're looking for something right here in between. You can also do some alternates where you go high plank for about 20 seconds, go into a low plank for about 20 seconds, come back up into a high plank for about 20 seconds, and alternate and do that as many sets as you can. Also, if you want to make this a little bit more difficult, you can always throw up a leg. Now you're also getting some glutes into the exercise. You can hold this for 10 or 20 seconds, put it down, bring the other leg up, hold this for 10 or 20 seconds as well. But that's planks. It's also a very good exercise for the transverse abdominis. Last exercise for the transverse abdominis is leg raises. You want to get into a seated position and you want to lean back. Initially, your hands may need to be back here to help support, but eventually you want to do it so that you can get your hands up around your hips or in front. And you want to start with a single leg lift up. You can even pull it in, back, and down. Up, in, back, and down. If you want to make this exercise really hard after you get used to it, do both legs at the same time. You come up in, up, and down. Up, in, up, and down. And that'll be a burner. But that's the last exercise for the transverse abdominis. But now let's look at a couple of specific exercises for the gluteus medius. The first exercise, I'm going to take some of this stretchy elastic banding, or you can use tubing. It can usually be found at most larger sporting goods stores. Wrap it around the upper thighs or down even closer to the knees. That'll make the resistance a little stronger. And you just want to take several shuffle steps, kind of like a half squat, to each side. So we'll go out, together, out, together, out, and together, and then you come back. And you just want to go several steps to the right, several steps to the left. The last exercise for the gluteus medius is some sideline leg lifts. You want to get in a position like this, and what we're going to do is we're just going to extend our leg up like this. Now here's a couple of things. To make sure that you're isolating the gluteus medius, you want to bring your exercising leg just a little bit behind your base leg, and you want to take your toes and slightly rotate them towards the ceiling. Do your leg lift like this. Now I could be using the same rubber band that I used in the last exercise, have it down around my ankles and be using that for resistance, or in this case I'm using one of those ankle weights where it's variable. You can have anywhere from like 1 to 4 or 5 pounds in it, and use that as a resistance to help make this exercise just a little bit harder. Now here's an exercise specifically for the gluteus maximus muscle. So you lay back, you bring one leg up, and then the other leg, the heel is up close to the butt, and what you want to do is just extend up until you're just about in a straight line. These are called butt bridges. So you go up and you're working the glute maximus and down, up and down. Alternate legs, up, straight line, down, up, straight line, and down. That's for the gluteus maximus. Now here's a couple of exercises for the hip adductors, or the groin muscles. And the groin muscles are the ones that are responsible for bringing our legs together. So getting back in like a sideline position, take your back leg, put your foot on the ground, your knee up. This is the leg we're going to be exercising, and what we want to do is just raise it up off the ground and down, up and down, like you're trying to bring this knee up to meet this knee. You can make this exercise a little harder also by using those ankle weights down around the foot. Another good exercise for the groin muscles. Find a ball, put it between your ankles, raise it up. Now this exercise is obviously going to be exercising the abdominal muscles, but at the same time you're having to squeeze your legs together to hold that ball in. And if you're at the gym and you can use one of those medicine balls that are 5 or 6 or 8 pounds, the weight of the ball makes you have to squeeze in even harder not to drop it. And so that'll make it an even harder exercise. And you can use a small ball like this, or you can use one of those larger stability balls that we do exercises on. But I'm already feeling the burn in my groin just from having to push together to hold this ball up. Now here's an exercise for the quadriceps, the last group of muscles that Dr. Johnson was talking about in his interview. Find a small step. You could even use a curb out in front of the house. I've got this small step. I'm going to step up on it, and I'm going to do what's called like a partial squat. I'm just going to go down, let my foot approach the ground, hopefully not touch, stand up, down and up, down and up. Your goal, you do not want this knee to cave in as you go down. You want it to stay pretty much in line. Down, up, down, up, This exercise takes a little bit of getting used to, and you might find it's a little hard to keep your balance. So you might do it next to a wall or something that you can kind of keep your balance on as you do this exercise. And then of course you would switch and do the other side as well. That's for the quadriceps.